High blood pressure, management, understanding the silent killer. Welcome to Health Matters, your weekly guide to better living through medical knowledge. I'm your host, Lindiwe, and today we're discussing a condition that affects nearly half of American adults, high blood pressure, also known as hypertension. It's often called the silent killer because many people don't even know they have it until serious damage has already occurred. Today, we're going to break down what you need to know about high blood pressure, its symptoms, its relationship with stress, and importantly, how your diet can help manage it. We'll also recommend some excellent resources for further reading. So let's dive right in. Why is high blood pressure such a concern for healthcare professionals? Well, when your blood pressure is consistently too high, it puts extra strain on your blood vessels, heart, and other organs like your kidneys and brain. Over time, this can lead to serious conditions, including heart disease, stroke, and kidney damage. The scary part is that most people with high blood pressure don't experience any symptoms until significant damage has already occurred. That's what makes regular blood pressure checks so important, especially if you have risk factors like family history, being overweight, or advancing age. But Sarah, are there any symptoms people should watch for? While high blood pressure is largely symptomless, some people might experience headaches, dizziness, shortness of breath, or chest pain when their blood pressure is extremely elevated. But it's important to note that these symptoms aren't specific to hypertension and could indicate other medical conditions as well. We get a lot of questions from listeners about the connection between stress and high blood pressure. Stress doesn't directly cause chronic high blood pressure, but it can certainly contribute to its development over time. When you're stressed, your body produces hormones that increase your heart rate and constrict your blood vessels, temporarily raising your blood pressure. Chronic stress can lead to unhealthy habits like poor eating, excessive alcohol consumption, or inadequate sleep, all factors that can contribute to hypertension. That's why stress management techniques are so important. Stress management, regular exercise, meditation, deep breathing exercises, and ensuring you get enough sleep can all help. Sometimes just talking to a friend, family member, or professional counselor can make a big difference too. Let's shift gears to talk about diet. I know nutrition plays a crucial role in managing blood pressure. The foods we eat can have a significant impact on our blood pressure readings. A diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy products is highly recommended for managing hypertension. This kind of eating pattern is often referred to as the DASH diet, dietary approaches to stop hypertension. Question from our listener: are there specific foods that are particularly helpful? Yes, several foods have been shown to help lower blood pressure. Berries are rich in antioxidants that improve blood flow and reduce inflammation. Leafy greens like spinach and kale are high in potassium, which helps counteract the effects of sodium. Oatmeal is high in fiber and can help lower cholesterol levels, which indirectly helps with blood pressure. Another question from our listeners: what about protein sources? Fatty fish like salmon are excellent because they contain omega-3 fatty acids that reduce inflammation and lower blood pressure. And don't forget about yogurt. It's a good source of calcium, which is another mineral associated with lower blood pressure readings. Another listener would like to know, what should people be limiting in their diet? The big one is sodium. Most Americans consume far too much salt, which directly contributes to high blood pressure. Aim to keep sodium intake under 2,300 milligrams per day, or even lower if you already have hypertension. Also limit saturated and trans fats, added sugars, and excessive alcohol, which can all contribute to heart problems and hypertension. This is all such valuable information. Before we wrap up, are there any resources you'd recommend for our listeners who want to learn more? Absolutely. I highly recommend checking out Nature's Pharmacy, The Healing Power of Fruits and Vegetables by Larry Allen. He also has a great companion book called Nature's Pharmacy Meal Plan, 7 Days of Healthy Eating for Optimal Health, that provides practical meal planning advice. Those sound like excellent resources. Remember, listeners, if you're concerned about high blood pressure, the first step is to get it checked regularly. Know your numbers and work with your healthcare provider to develop a management plan that works for you. That's right. With proper monitoring and lifestyle changes, high blood pressure is very manageable for most people. Thanks for joining us today on Health Matters. I'm Lindiwe. Take care of your heart, and we'll see you next week.